Welcome to This Explainer. Today we're tackling a massive question, one that's literally at the heart of public health and, honestly, our everyday lives. Is poor health just the result of bad individual choices, or is the socioeconomic system actually stacked against us? I mean, for decades we've been told that if we just eat right and hit the gym, we're going to thrive. But as we'll explore today, the science of epidemiology is telling a much more complex and frankly fascinating story about how our environment completely dictates our habits. So, here's our roadmap for today. We'll start with the lifestyle choice paradigm, move on to the successes in public health, and then tackle the victim-blaming problem. After that, we'll dive into hidden socioeconomic barriers, and finally wrap up with a new policy framework. Section 1. The lifestyle choice paradigm. Okay, the cultural-behavioural model. It sounds a bit technical, but this is actually the foundation of how most of us were taught to think about our health. If we strip away the academic jargon, this model essentially says that your health is entirely in your own hands. It suggests that population health outcomes, and especially the health gaps between different socioeconomic classes, are primarily driven by the daily lifestyle choices made by individuals. Under this framework, chronic conditions, things like cardiovascular disease or type 2 diabetes, well, they aren't just random bad luck. They're viewed as the cumulative result of your personal agency over a lifetime. The focus here is heavily on what public health calls modifiable targets. We're talking about proximate determinants like tobacco consumption, your daily dietary habits, alcohol intake, physical activity levels, and whether you're getting preventative health screenings. The appeal of this model is totally obvious, right? These are highly actionable targets. They are things you and I can wake up and theoretically decide to change today. Moving on to Section 2, successes in public health. Now, we absolutely have to give credit where credit is due. Treating these habits as modifiable targets has been incredibly successful. The whole concept of risk factor epidemiology has literally saved millions of lives. It really gained momentum back in 1948 with a landmark Framingham Heart study, which successfully flagged behavioral risk factors like high-sodium diets and sedentary lifestyles. After decades of tracking, this surveillance conclusively linked behaviors, particularly tobacco use, to lung cancer and cardiovascular events. And today, that data drives behavioral modification programs, like smoking cessation campaigns, that give people incredibly clear pathways to reduce their risk. But beyond just the statistical wins, there is a profound psychological benefit to this model, and that's empowerment. By framing our health outcomes as something we can actively change through lifestyle adjustments, the behavioral model really promotes active patient engagement. It makes people feel in control. It basically says, hey, you have the personal agency to take charge of your well-being through informed choices. And for sure, that is a highly motivating message for preventative healthcare. Section 3. The victim-blaming problem. But here is where we need to execute a pretty sharp pivot. Relying solely on personal responsibility has a heavily criticized dark side. Social epidemiologists argue that the behavioral model has a really narrow explanatory scope. Ask yourself, have you ever felt like generic health advice completely ignores the reality of your daily life? When public health focuses exclusively on individual choices, it begs a massive question. Are bad habits actually a choice, or are they a symptom of something much larger? It's absolutely fascinating to look at this disconnect. On one side, you have standard individual advice, right? Eat more vegetables, exercise daily, stop smoking. But pit that against the complex, totally exhausting reality on the other side. Neighborhood food deserts, 60-hour work weeks, chronic poverty stress. When that simple advice is thrown at the reality of marginalized groups, it almost always fails. A purely behavioral approach tends to completely isolate a person's choices from their economic context. And this brings us right to the victim-blaming fallacy. Back in 1995, researchers Link and Phelan famously wrote about social conditions acting as fundamental causes of disease in the Journal of Health and Social Behavior. Their work, alongside many others, validates that calling out this victim-blaming isn't just a talking point, it is scientifically grounded. When we attribute poor health solely to bad habits, we are completely ignoring the massive structural constraints that systematically shape those choices in the first place. Section 4. Hidden socioeconomic barriers. Let's zoom out for a second, from the micro level of individual choice to the macro level of the economic structures dictating those choices. For any public health leaders tuning in, this is the absolute crux of the issue. When we look at lower socioeconomic groups who happen to exhibit higher rates of adverse behaviors, we cannot pathologize these populations. Often, these behaviors are entirely rational responses to incredibly adverse living conditions. We're talking about chronic poverty and material deprivation. We're talking about high-stress environments, living in neighborhood food deserts where fresh produce is literally unavailable, and being subjected to aggressive corporate marketing of unhealthy commodities. I mean, it's pretty tough to just choose to eat a fresh salad if the only store within 3 miles thinks a potato chip counts as a vegetable. Epidemiologically, this introduces an eye-opening concept called reverse causality. Treating behavior as the only independent variable completely oversimplifies how disease actually develops. Chronic stress, material deprivation, and early life adversity actually alter human biology. They directly influence our psychological and neuroendocrine states. These altered states practically force coping behaviors, like smoking or alcohol consumption, just to get through the day. The stress causes the habit, which causes the disease. So disease etiology is way more complex than just a simple lifestyle choice. This dynamic brilliantly illustrates why traditional downstream interventions can actually backfire. Think about it. If you run a generic educational campaign telling people to eat better, affluent populations with time and money have a really high adoption rate. But disadvantaged groups who lack those resources literally cannot adopt the behaviors. The shocking result? The long-term efficacy is incredibly low for the disadvantaged, meaning the campaign actually widens health inequalities. Without altering the underlying material environment, educational campaigns only help those who already have the resources to help themselves. Which brings us to Section 5, a new policy framework. So we've looked at the strengths of the behavioral model and its severe systemic weaknesses. The crucial synthesis is this. Health advice is basically useless unless it's accompanied by removing the socioeconomic barriers. Telling someone to exercise is practically pointless if their neighborhood isn't safe to walk in, or if they're working 3 jobs just to pay rent. Step 1, behavioral education, must be immediately paired with Step 2, removing socioeconomic barriers, if we ever hope to reach Step 3, sustainable health equity. To summarize this new framework for a modern era, public health can no longer afford to operate in silos. Yes, behavioral strategies give us actionable targets. We absolutely still need to know that smoking causes lung cancer. But applying that model in total isolation, it suffers from serious reductionism. We must integrate those behavioral strategies with structural interventions that address the root, material, and social determinants of health. We have to balance individual agency with real environmental modification. That is literally the only sustainable path forward. I want to leave you with one final, provocative thought as we look through this newly widened lens. As long as we just blame the individual, we give a free pass to the environment around them. So the big question is, will we continue treating the symptoms of inequality by just telling people to make better choices, or will we finally step up and cure the system itself? Thank you so much for joining me for this explainer. I hope it gives you a powerful new way to look at health, habits, and the world we all live in.